Okay, good evening, doctors. My name is Dr. Kronk, and welcome to tonight's program, The Three Things That You Must Do Well in Order to Build a Huge Spinal Injury Practice in 2017. We're just about ready to get started. I see I've got a number of doctors that are just logging in, so I'm going to give just a little bit of time, and while I'm actually taking just a little bit of time to allow some more doctors to actually log in so they can see this right from the beginning. By the way, this program tonight is designed for doctors who have never seen me speak on this topic before. I have lots and lots of doctors that I train. This is for absolute brand new doctors who have never seen me present anything like this before. So before I start, I want you to actually just, if you would, type into the question box. If you look over on your dashboard to the right, I want you to just type into your question box, I can hear you fine, or I hear you. Go ahead and just let me know, anyone there, that you can hear me. You can hear me just fine. So if you would type in, okay, good, great, this is absolutely perfect, fine, okay, great, I see that I'm being heard just fine. So what I want to do, again, I want to tell you welcome tonight. Tonight I want to take some time to go over and give you an idea of really what it takes to build a very huge spinal injury practice in 2017. The environment has changed dramatically, things have changed dramatically, and it's never been harder, but it's never been easier to build a large injury practice. So I'm going to get started right away. One of the first things I want to talk about is why fill your waiting room? What would it be like if you had a waiting room that was filled every day with injury patients? I mean, what kind of impact does that have on your practice? You know, if all of a sudden you looked in your waiting room and for most of the day it was filled with injury patients, what would that do for you? What would that do for your practice? What would that do for your staff? What would that do for your family? Really, what would that do for you? I mean, I know one of the biggest things for me early on is that I realized that the thing that I liked working on the most was injury patients. And the reason why I liked working on injury patients is because they're extremely high risk for long-term residual complaints if they're not handled properly early on. That's what I loved about injury work. Now, the other thing most people love about injury work is that injury work is highly rewarding and is highly lucrative. I mean, it's a nice practice because the providers that actually provide injury care get paid well to do it. I'm going to tell you right now that the injury provider will be the most sought after provider. They're the most they're the most important providers in the market today. Absolutely, and I'll explain exactly why. Now, here's the thing. A lot of doctors, I know myself early on, just did not know how to draw in injury patients. How do you get injury patients? How do you crack into the injury patient network? What do you do to get them? Right? Well, what I'm going to tell you right now is I'm going to teach you tonight 3 things that you need to do extremely well. And in doing so extremely well, you will start to get those patients. So here's what I'm going to tell you. I wrote a small ebook called The 7 Essentials to Getting Great Recovery Results and Excellent Legal Help for Any Spinal Ligament Injuries. And it's a small book that actually tells the patient exactly how important a good injury doctor is and why. Now, for those of you that stay to the end of this program tonight, I'll show you how you can get a copy of that for free. Okay, now what I want you to do though is this is important enough for providers that understand that today $1 million injury practice is totally accessible. You can build $1 million injury practice today. So what I want you to do though is I want you to slide your power off. I want you to get rid of your cell phone. I want you to get rid of the internet. I want you to just get quiet for a little while. And let me show you what I'm talking about, because what I'm talking about tonight can change your clinical life, and it can change your professional life, and it can change your personal life in quite a dramatic way. So I want you to give it the due because I want you to take advantage of what I'm sharing with you tonight, right? The biggest thing in building an injury practice is a foundation. You have to set a foundation. Now, building the foundation, oftentimes a lot of people think it's the boring part. By the way, this building fell over. And this building, it was determined, had a, the type of foundation that a normal single-story house probably would have had a hard time lasting on. The person that built it cut corners on the foundation. And so, when you build a spinal injury practice, it has to be built on a foundation. And the foundation is what gives it legs. It's what gives it longevity. It's what makes it a pillar within the community, so that you have a spinal ligament injury practice or spinal injury practice for the next 20 years that you can sell, that you can give to somebody else, that you can bring associates in, that they can have run for you. I mean, the nice thing about an injury practice is that once you have it up and running, it's really easy to scale. And when I mean scale, it's very easy to systemize, so you can have other people come in and provide services for you. So the reason why you want to create such a great foundation is because of what it can do for you, right? Wouldn't it be nice if you actually had it to the point where, if you wanted to take a vacation, you could. You could start spending time with people that you really want to spend time with, which is probably your family, and places that you want to spend time at. And also so that you can build something that you have a staff that can do the same. Right? An injury practice is a highly remunerative practice, and it affords the ability to do that, to do all of that. But you also, in an injury practice, you have to constantly deal with people who are injured. And like right here is a low back pain patient. Low back is the #1 cause of disability and pain in the world today. Medical management of this condition right now is $9,000 to $19,000 per year under medical guidelines for just management of this condition. And it's actually the most common diagnosis of this is nonspecific mechanical low back pain. There's nothing specific about that, right? You have to deal with chronic neck pain or people who have neck injuries, right? You have to deal with people who have chronic headaches. So you have to deal with that, and part of how you deal with it and you stay really sane and you stay really upbeat is because you know that you're delivering a product that is actually saving their life and changing their life. And you know that you actually have, and the 3 things I'm going to show you, when you have these 3 things and you can deliver these 3 things, you become quite exuberant and quite confident in what you're doing. So who am I? Well, for those of you that don't know me, my name is Jeffrey Kronk. I've been a licensed doctor of chiropractic since 1988. I don't know how many years that means that I've been licensed, but a long time. I was in private practice for 17 years. I am the Director of Education of Spinal Kinetics. That's the largest, most well-known ligament injury testing company in the country today. I'm also the president of and the CEO of American Spinal Injury and Impairment Consultants, and that's you're watching a program by AMSIC tonight. And I have one of the best educational programs in the country for spinal ligament injuries and educating doctors on spinal ligament injuries. So I'm on the board of a publicly traded company based on the principles that I'll share with you tonight. I'm also on the advisory board of the National Pain Foundation, again, based on the principles that I'll share with you tonight. So it doesn't really matter how big or how small or what you want to run. You can do whatever you want to with these 3 principles that I'm going to share with you tonight. Now, injury is the primary event that initiates a disease called chronic pain. The reason why injury providers in this new market, in this new market environment, are going to be so valuable is because they can knock out chronic pain before it actually starts. But the injured patient has to get to the doctor early in order to do that. Now, when we talk about chronicity, it's really easy to talk about, there are different mechanisms that cause injuries to the spine, right? Car collisions are one of them. And car collisions are probably one of the most heavily studied conditions, simply because the economic impact to society is about $836 billion per year. just from auto collisions. That's not work comp, that's not war, that's not horse accidents, that's not diving accidents, that's not sports accidents. That's just one type of mechanism that causes an injury to the spine called auto accidents, right? Now we know that these patients suffer on a regular basis. 44 to 90% of the patients with chronic 2-year follow-up. 86% of the patients, 10 to 19-year-old follow-up were chronic. Long-term prognosis for soft tissue injuries, chronic. And the longest study ever performed on whiplash injured patients, a study looking at the health status of 17 years after injury, 55% of the patients suffer from the pain caused from the original trauma. Okay, these patients, when they undergo a trauma, have very, very high risk of being a long-term chronic patient. Now today, that's extremely expensive in the system to be that way. Extremely expensive. Long-term studies say that a chronic pain patient will spend north of $8,000 to $12,000 per year in additional medical expenses. So if it's $12,000 per year and it's 10 years, $120,000. That's a lot of copay. That's a lot of deductible. That's a lot of money, right? And we're only talking 10 years, and we're not even calibrating for the fact of what inflation is going to mean for that money 10 years from now. So it's even more dramatic than what I'm suggesting to you tonight. A single back injury, if it goes out to the 3-year mark in workers' compensation jurisdictions, it's over $250,000. Carpal tunnel syndrome, usual ligament injury in the wrist, same thing. 3 years, it's over $150,000. These conditions are extremely expensive. OSHA recently came out and stated that musculoskeletal injuries may destroy a family's emotional and financial security, and the toll on an injured worker is intolerable. Now, here's the thing I need to ask you, right? And I want to ask you, would it be, and I want you to type into the question box, would it be amazing if you could become like your area's go-to center? You could start to build a foundation that allowed you to build a center where you could have multiple doctors if you wanted to, you could have medical doctors if you wanted to, but you could have a state-of-the-art, and you could also do it right from the foundation that you have now. Would it be amazing? I mean, would you like to have a injury practice where you seriously could help people, one, reduce their risk of chronic pain and get a great result, and then two, seriously reduce their costs? I mean, just give me an amen, or give me a yes, or yeah, that would be really cool. Just type in. Let me know out there that that's something that you think would be actually a good thing to be able to deliver. I mean, would it be amazing to actually have a practice where eventually you don't have to work, hell yes, oh yeah, amen, oh my God, yes, 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 okay, good. I mean, wouldn't it be amazing if you actually had a practice where eventually you were so well known you didn't have to market much? Well, that's what's possible today. My dream, that's perfect, yes, yes, okay, good. Yes, with exclamation marks, okay, good. All right. So, and I appreciate your communicating, because that gives me some energy to kind of show you the route here. Okay. The financial devastation that can occur with a family that has chronic pain from a injury is excessive today. Now, what I want to do tonight, and I want to go through this fairly quickly, I'm going to give you the 3 things today, just 3, in today's market that you have to be able to do really well in order to have the practice that you want to in an injury market. And especially, obviously, tonight we're talking about the spinal injury market. Okay, the very first thing, and this is going to sound amazing to you because you're probably all saying, well, gosh, I diagnose things. You have to have an accurate diagnosis of all the patient's injuries. And the biggest diagnosis that you have to have is you have to be able to locate and accurately diagnose the spinal ligament injury, because it's the most problematic injury in the market today. bar none, has the most costs, causes the most chronicity, causes the most pain, the most disability. So you have to be able to diagnose this. This is the primary thing. This is the thing that a whole foundation of a spinal injury practice is built on today. In the past, you really didn't have to have accurate diagnosis. You could just say whiplash, you could say sprain strain, and you didn't have to know where it was or how bad it was, and then you just shotgun approached adjusting the spine, 30, 40, 50 times, and lo and behold, some patients improved, and lo and behold, a lot of patients didn't fully improve. And a lot of them came out with just, chronic problems. That's in the chiropractic profession. That was what has occurred in the past. In the medical profession, they're not really sure, and I'll make it very clear to you tonight, how to determine the severity and location of a spinal ligament injury, and that provides the biggest opportunity for new providers to actually go out and make relationships with medical doctors, because medical doctors don't necessarily not want to help their patients. They just don't understand the conditions oftentimes that they're treating. And if you don't understand and you don't diagnose accurately the condition that the patient has, which I'll make very clear to you here in just a minute, then your chance of treatment are not very good. Your chance of good treatment results are not very good. So your number one thing that you've got to do is you've got to be able to diagnose this thing. Now, again, that's going to sound kind of funny to some of you tonight, but let's make sure we understand what diagnosis is. It's the identification of the nature of an illness or other problem by examination of the symptoms. Okay, now, I think everyone knows what symptoms are. Some people kind of fail on this word, nature. They don't know what nature is. Nature is anything that occurs physically, in the physical world. Everything that's in the physical world is nature. Okay, so when we talk about the nature of something, we're talking about the physical phenomena of something, right? So how diagnosis occurs is we look at the symptoms, and then we go backwards to a physical cause. And that's what diagnosis is today. So 100 million Americans suffer from chronic pain, right? Low back, number one cause of disability and pain in the world today. Neck, what we talked about earlier, fourth leading cause of pain and disability in the world today. So between neck and lower back, there's more patients in your community to fill your clinic than you could possibly put in your clinic. Your clinic's not large enough. Unless you're in a really small town, your clinic is not large enough to handle just back and neck. Now, let's take a look at migraine headaches or headaches. Migraine headaches are the third most prevalent and the sixth most disabling disease in the world. Okay, and that's from the Migraine Research Foundation. Nearly 1 in 4 households today include someone with migraine headache. And guess what? Here's the really funny thing. Okay, more than half of migraine sufferers don't have an actual diagnosis. The other half have a diagnosis of migraine headaches. Well, I'm going to tell you tonight that it's a ligament injury in the craniocervical junction is one of the most common causes of migraine headaches or any kind of headache. And these patients go undiagnosed. They go into doctors that don't even x-ray them. So of course they're not going to find out. They go into medical doctors. Medical doctors doesn't even x-ray them. Right? So of course they're going to find out that, or they're not going to find out this particular condition. And they're going to suffer needlessly because they don't have a doctor that can properly diagnose the physical cause of those symptoms. So, when we talk about symptoms, let's just share a couple. I'm just going to share some slides. If we want to look at symptoms of ligament injuries, good. Lower back problems are a symptom of ligament injury. Any kind of neck pain is a symptom of ligament injury. Any kind of chronic migraine headaches or any kind of chronic headaches is a symptom of ligament injury. Any unresolved shoulder, arm, wrist, elbow pain is a symptom. Today, now when I say a symptom, I'm not saying it because Dr. Kronk says it's a symptom on some program tonight. I'm talking about you can go out to Medscape and look up cervical spine or cervical sprain, and you can see every single one of these conditions as an identified symptom of a spinal sprain or what's called a spinal instability. A spinal instability is the inability of the spine to maintain alignment under a load. and it causes either cord pressure, nerve pressure, or causes pain. Now, we all know, the doctors online tonight, that if it causes pressure on the nerve, that causes nerve interference, right? So we know that unresolved arm pain is a common symptom of a spinal ligament injury. We know that the feeling of heaviness or weakness, or the a sensation of shock, or the sensation of tingling, pins and needles going down the arms or legs, is a symptom of a spinal ligament injury. Now, we also know that leg pain is a symptom of a spinal ligament injury. Sciatica is a symptom of a spinal ligament injury. Now, we can even get into a little bit more abstract, or what seemingly for a lot of doctors are abstract. They're not abstract at all, not once you understand ligament injuries. Unresolved dizziness. Sorry, we'll go back to the other one. Chronic vertigo. Visual disturbances. Now, these may seem kind of different and interesting to you, but these are right out of Medscape. Okay? Chronic tinnitus. So the key question that a lot of doctors, they minimize this thing of, well, you can locate the actual location of this condition. And they minimize because they're not really sure, especially in trauma work. I mean, the cervical spine is I'll give you an example. The cervical spine is a large piece of real estate. So is the spine in general. Most doctors today make it like it's just all one thing. That'd be like calling the leg just a leg, right? You wouldn't say, well, there's a hip, there's a knee, there's ankles, there's feet. There's a lot of things that form a leg. Well, there's a lot of parts to a cervical spine. So let's say that we have a person who's injured and they have they have degenerative disc disease at C6 and C7, but they have a new injury that's completely at C3. Now, somebody's going to say, well, look, all their symptoms are based on a pre-existing condition. Well, that'd be like somebody who has a leg injury, who has a knee injury that's new, having some doctors say, well, look, they've got degenerative disc disease, or they got degenerative joint disease in their ankle, and that's what's causing their leg problem. It's just as goofy today, but a lot of doctors don't understand things like pre-existing conditions, and they don't understand just how broad of a piece of real estate each portion of the spine is, right? And the other thing that they're not sure of is this thing called a mechanism of injury. So they're not sure remember, when we diagnose, we're looking for a physical phenomena. Doctors, anytime that you injure a person, you derange something in that person. Now, I don't mean mentally derange them, I mean physically derange them. If you're going to injure them, you physically derange them. So if someone is injured by any of the activities of being in an auto collision, or lifting something at work, or having a slip and fall, or in a sports injury, or in a domestic violence injury, or in a war injury, there's so many different mechanisms that can cause injury to the spine. But if they undergo where there's compression and shear force, then they undergo a derangement pattern. And understanding what those are is the basis of understanding what's called a mechanism of injury. So a mechanism is a force delivery system that's capable of causing injury to the human body. Now, anytime that you're around a mechanism, like a dog in this case, doesn't mean you're going to be injured. You could go through 10 high-impact car accidents and never be injured. You could go through one low impact, no damage, and be severely injured, right? Now, what you have to know, though, in order to show that, is you have to know what the injury patterns are, and you have to know how to diagnose them, right? So if I'm a dog bite specialist, I better know what the lesion or the injury or the derangement patterns of this particular injury look like, right? Now, if I'm a burn specialist, first of all, that doesn't occur. The mechanism isn't a dog, right? But I ought to know what a burn leaves behind. This is called a lesion or a derangement pattern, right? Now, same thing. This is not a burn. This is not a dog bite. This is obviously from a different mechanism, right? Now, just because this one obviously is severe, it's a bullet hole right through the middle of the leg, right? But I could take that same gun and I could just scratch the leg. So if this blood right here were just a scratch and there was no hole here, this person's still been shot. So just because somebody actually goes through a mechanism and gets damaged, you have to have a doctor that can assess accurately the severity and location of that damage. And not all patients are damaged severely. So if this person comes in with a scratch from the gun, from the bullet, scratching the skin, they have been shot, right? But it's not as severe of an injury. So today, what we talk about, let's talk about auto collisions, because that's one that, it's the most well-known, it's the most studied. Like I said, economic cost to society about $836 billion, about $240 billion to insurers a year. And so it's the most studied of the mechanisms, right? So when this person actually has a injury to the spine, they need to actually have a doctor that understands exactly what that lesion pattern would look like. So if I said to any doctor that was treating the spine, if you have an auto collision and it damages the spine, what do the lesion patterns look like? And if that doctor couldn't answer that question, that would be no different than going to a dog bite specialist, a so-called dog bite specialist, and saying, gosh, if a patient had a dog bite, what does the injury look like? And not being able to describe exactly what a dog bite looks like. Now, I want you to think right now, and I want you to tell me if I asked you, and if you've seen this question before, you don't have to answer it, but for those of you that haven't, I want you to give me an answer in the question box. If a person injures their spine here, what are the 3 most common imageable injuries you're going to see? Just as common as you would see a dog bite with a dog bite injury. So what would those 3 things be, or what would the common things be that you would actually see? Okay, so I just want you to tell me what 3 common things would you see with an injury to the spine? Now, I can tell you right now, with all the doctors that I have online tonight, it is dead silent on this question. Dead silent on this question. Now, this is why there's so much chronicity with spine problems. Now, let me ask you a different question. If you could easily understand exactly what the injury patterns were, how to diagnose them very, very quickly, and then be able to do that better than anyone else in your community, would that be something that would be beneficial? Yes. Good. Yes. Yes. Okay, I see. Yes, yes, yes. Okay, so what if you were practically the only one in your community that understood what those lesions were? Would it be easy to go out to medical providers potentially and express information to them in order to get them to send patients into? By the way, just so you know, there were 64 million injury visits to medical providers in a common year. 64 million. Now that may sound like a lot to you, but there's 956 million visits to medical providers in any one year. Right? So there's 64 million. Now I'm going to tell you right now what I'm about to share with you are what these injuries look like. They are the physical phenomena. They are what you diagnose. And once you understand how to diagnose them, you'll understand how to treat them, and you'll understand how to do one other thing that's really important. So, but let me know, how important, how cool would it be if you actually knew the simplicity of this and could communicate it easily out to your public? How cool would that be? Yes, very cool, very cool. Can't wait. Go ahead, show me. Sweet. All right, good. And I appreciate your participation. Okay, so here's the thing. Whenever you have a shear force or a compressive force, the most damaging problem, the most problematic thing right now in the human body to damage is the ligament. Right? Now, ligaments have a very particular thing that happens. Right? When you damage ligaments in the spine, you cause excessive motion in the spine. It goes by the name of joint laxity, excessive motion. You could call it also, so we have excessive motion, right? And we also have disc herniation. So there's, just to give you an idea, we also can have a fracture, right? So there's excessive motion. This is the worst of the injury, right here, excessive motion, because it causes an instability of the spine. And by definition, instability in anything causes unpredictable, erratic behavior, right? So anything that's unstable is unpredictable and can have erratic behavior, right? It can be problematic, right? So you have this excessive motion, right, which we can easily find. Now, how do you find that? You find it on X-rays. You can't find it on anything else. You can't find it on an MRI. If we have a disc herniation, great. That's picked up on an MRI. That's one of the discs, and we have fractures. So let's take a look at this once. In the human body, in the human spine, I guess we'll just go with the human spine, the American Academy of Spine Physicians says there's 220 specialized ligaments. Now, if you look at these ligaments, right, and we're not going to name them all, but there's 10 ligaments that hold a motion unit together. One of these is a disc. Now, if there's 10 ligaments that hold this thing together and one of those ligaments is a disc, what percentage of the ligaments are a disc? 10%, right? Okay, so if we look down here and we say, well, look, there's 23 intervertebral discs, there's more than 220 specialized ligaments, what percent of the ligaments that hold the spine together are disc? 10%, right? We have a cranial-cervical junction. We have a lot of ligaments in the cervical spine that aren't involved at all. There is no disc. There's no disc between C1 and occiput or between C1 and C2. There is no disc. The discs start at C2 and C3, right? So what we know today is that X-ray is the main featured examination procedure to determine excessive motion in the spine. And it's the easiest process there is to do. It's just an excessive motion test. That's what spinal kinetics, that's what we built our whole company on, the understanding of this phenomena. So when ligaments are damaged, they cause excessive motion. The joint goes into excessive motion. And so we built a science-based injury technology called computerized radiographic measuration analysis, measurement analysis. We measure the relationships of joint motion on X-rays, right? So it's very easy, if you've ever never seen one, it's very easy to look at this and go, okay, where's the excessive joint motion? Well, it's at C2. Now this happens to be a very severe sprain finding. Now, the purpose tonight is not to explain to you how this testing goes or to explain to you how to interpret the test. All you need to know tonight is if you're looking at excessive motion and you just look at these bar graphs, this one looks the worst, right? So it's very easy to determine the severity and location of ligament damage because what it leaves behind, the dog bite that it leaves behind, is excessive motion. Now, it can also leave one other dog bite behind, which is disc herniation, which I'll explain to you in just a second. This is a lumbar spine, same thing. I mean, you look at this and you go, okay, L5 on S1 is not doing good here. Doctors, it's not doing good at all. It's highly unstable, right? So it's very, very easy. This should be completely lined up. Now, this is a cranial-cervical junction ligament injury. Your most common injury for patients that have headaches, that have cognitive dysfunction, that have post-concussive disorder syndrome, that have whiplash-associated disorder syndrome, that have cranial-cervical junction syndrome, have Barley-O's syndrome. This is your physical finding. This is what you're going to find. Now, it can look a little bit different. It can look more dramatic. It can look less dramatic, but this is what you're looking at. This is what you're going to see, right? This tells you that you have ligament damage because these structures are misaligning because the ligament is no longer able to keep it in its normal pattern of position under stress. Now, we said, hey, look, there's 200 and, over 220 specialized ligaments, and we said, gosh, look at this. Here's an MRI report. Now, where does that MRI report start? Well, it starts at C2 and C3. Why? Because a modern MRI study today is a disc study. So it's only a study of about 10% of the ligament structure of the spine. And if you're only going to rely on an MRI and you don't understand how to do a proper X-ray analysis, you're missing a ton on just about every patient that's injured. In my opinion, in my experience, I believe that doctors that do not do a motion analysis on any patient that they suspect a ligament injury on are close to malpractice. To me, it'd be like a heart patient coming into a heart doctor, to a cardiologist, and not having an EKG done. Okay? You cannot determine the severity and location of a spinal ligament injury without imaging. That's how you determine it. And it's not determined on an MRI. We said there was 10 ligaments that hold this together. Well, what about the posterior longitudinal ligament? How come it's never reported on an MRI study? Or the anterior longitudinal ligament, or the capsular ligaments, or the intertransverse ligaments, or the ligament of flavum, or the interspinous ligament, or the supraspinous ligament? And don't get confused, doctors. It's so easy to get confused in this market because, remember, the area that actually has the most unsolved problems, and when you look at the area of chronic pain today, it's unsolved. And it's unsolved because those are the areas, whenever you look at an area that's highly unsolved, it's because there's a lot of confusion in that area. There's a lot that's not understood, and confusion is contagious, right? So we can look at this disc herniation, and we can look at this MRI and say, look, one of the most important areas of ligament structure is right here. And nothing is normally reported in the craniocervical junction. Right? Again, we have all these ligaments, and basically we have a disc herniation test. That's fine, but that's not much of a ligament assessment of the spine, quite frankly. We can have a perfectly clean study. Well, maybe we got some disc bulges, but fairly clean study, and have severe ligament injury, have severe excessive joint motion, which shows if there's a problem with the nerve, either motor, sensory, or pain associated with this area, you have a spinal instability by definition. Now, you also have in the profession of chiropractic, by definition, a spinal subluxation that's active. So this, we can have a disc herniation that has no excessive motion above, below, or at that level. Okay, then we know, how did that occur? It occurred through compression force most commonly, because if it occurred with a combination of shear and compressive force, we should have sheared the other ligaments and they'll show excessive motion. Now, just quite frankly, this disc herniation should be very easy, one of the easiest disc herniations to rehabilitate, much easier than, say, this disc herniation. This disc herniation is both a herniated disc and excessive motion above, at the level, or below. This is one of the toughest, most challenging soft tissue injuries to the spine to rehab. Now, our doctors know that. Now, what I want you to do is just type in, if you're what I'm showing you right now, just type in good stuff, or I like this. This makes sense. Just type in anything like that. Let me know that what I'm showing you right now makes sense. Doesn't it make sense? Quality, high quality, super. Never seen anything like this before. This totally makes sense. Okay, so wouldn't it make sense that what I'm showing you, good stuff? Okay, I totally get it. Now, what if I told you that it would be very easy for you to deliver what I'm sharing with you in your clinic? Would that make you different? Just type in, would that make you different? Yes. Yeah, really different. Okay, yes, absolutely. Okay, good. So what I'm telling you is that this is not hard, game-changing. This is not hard. And again, doctors, I really appreciate your participation because it helps. It helps to give me some feedback because when I'm doing a webinar, I can't see you. When I'm live in a seminar, if any of you have ever been in a seminar live with me, I'm very animated and I definitely get a feel for are you tracking with me or not. So this is just under one heading, doctors, accurate diagnosis. Now here's what I'm going to tell you. What I told you early on is the thing that causes acute problems or acute pain from injury causes chronic problems. So the same condition, the same phenomena is in the chronic pain patient. And chronic pain patients, if you've ever been in chronic pain for a long time, you'll do practically anything to get out of chronic pain, to find a solution to the chronic pain. I gave a big meeting one time to a very large group of defense attorneys and IME providers and insurance adjusters, the people that deny claims on ligament injuries. And I had an hour and I thought, okay, great. I'm the one that shows objectively how ligament injuries occur. So how I explained to them what it is that we did is I started out this way, right? You have to remember 50% of the American public suffer from some form of chronic pain, right? So I don't know, I had 120, 125 people in the room, which means 75, which means 65, 60 of them, whatever, have a chance of having chronic pain. So how I started off the talk was just to say, look, I know in this room that about half of you have some form of chronic pain. And I know that the half that you don't have to raise your hand, you don't have to identify yourself, you don't have to nod at me. I know you're in the room today. Remember, I'm giving a talk on injuries to insurance adjusters. I know you're in the room today, and I know that you suffer. But what I'm going to tell you is that you suffer from one thing. You suffer from what's called a ligament injury or a ligament condition. I don't care if it's in your knee, your shoulder, your elbow, your wrist, your spine. Most common area is the spine. So low back is the most common area, neck, headaches. These are the most common things. You suffer from a ligament injury, and the second thing you suffer for has never been diagnosed, not properly. And any doctor that doesn't know that it's there, your chance of getting great results with their treatment are probably very slim. Now, what does that do for you doctors that understand how to deliver this particular diagnosis, how to diagnose it? If you understand how to diagnose it, you're going to understand how to treat it. Now, if you're shaky on how to treat it, that's fine, right? Because you're very, very close to being able to get great results with it. Now, if we take a look at this, I'm just going to, I put in one more slide and I want to really show you this. I showed you this earlier. This slippage right here, these are the identified, agreed upon symptoms. Remember, we said diagnosis is you look at the symptoms and then you look back and say, well, gosh, what's going on here? Well, if you have a patient that has cognitive impairment from an injury, you have a patient that has post-concussive syndrome, and those symptoms are not abating, you're going to find it. You have recurrent disturbed vision, you're going to find it. Severe sinus congestion, tinnitus, vertigo, migraine headaches, a lot of times this is what you're going to find. Now, there are other things that can cause this, but what you're looking at, you know, if all of a sudden a person says, well, yeah, I have neck pain with these things, this is what you're going to find. Now, once you find this, you are the doctor that diagnoses it, and once you take a person out of the morass of confusion out there of what they come out with. I mean, I've heard patients who actually would come out with migraine headaches, right? And they have sinus surgery. And they come out with sinus surgery and it doesn't clear the migraine headaches, right? Or they're on the medications, the various things that you go on. So, by the way, sorry for when this blows up, this is quite, it's a bit blurry, but this is what a normal one looks like, by the way. So this is what the relationship should look like, right? So the very first thing that you have to be able to do is a complete diagnosis of all the patient's injuries. So if you want to develop an injury practice, you got to know what the injuries are, and you got to know how to diagnose them, because that's the number one thing that makes you super unique in practice today. See, in the days of old, doctors took x-rays. I don't even think they looked at them, right? I'm not sure what they were looking at on them. They just took them and said, okay, great, there's nothing serious. As a matter of fact, what a lot of doctors did is they said, hey, I don't even really know what I'm looking at. Here, take this out to a radiologist who also doesn't really know what they're looking at, certainly when it comes to ligament injuries. They cleared of, hey, there's no fractures and there's nothing bad here. I'm going to start to do general treatment, and I'm going to start to spray treatment all over the spine. And that's commonly what's passed off as treatment, right? There's nothing specific about it. So the biggest thing that you can be in this market today, and the most motivating thing, and boy, I tell you what, when I show you the pictures of the, staff and being able to go where you want to and take vacations and doing things like that, when you become unique in this market, you're unique in your ability to deliver this, that's what you're going to have, because you're going to start to attract patients that are looking for doctors like you. But you also got to do a foundation, and one of the things in a foundation is not a sprint. This is not a scheme. This is not some gimmick, right? This is not a sprint. This is a marathon. So you have to pace yourself. This is something that you decide that you're going to do long term, right? And then you just look to keep improving and improving and improving and improving your foundation. But your foundation is always based on the basics. And if you can't diagnose this condition, and if you tell me today that your diagnosis is sprain strain of the cervical spine, then I'm going to tell you that for a body injury, my body injury is injury to the body. Because that's how specific you are when you say sprain strain to the cervical spine. What area is injured? What parts were damaged? What parts aren't moving properly? How damaged was it? And where is it? And is it in combination with, is there disc herniation? Is there super excessive motion with the disc herniation? Is there craniocervical junction syndrome? Is there indicators of severe damage in the craniocervical junction? What's the lumbar spine doing? Right? So diagnosis is the key. Now, what's the second thing? The second thing that you have to be able to deliver. The second thing you have to be able to deliver is excellent results in treatment. Now, excellent results in treatment are really easy to deliver as long as you start to focus and understand that you maybe right now you haven't spent your career trying to figure out how to treat a ligament injury, right? What you just saw is how to diagnose it, and you saw it briefly. I mean, there's a lot more to it, but it's basically just that easy. And it's just that easy to treat it once you start understanding the ligament injury itself. And most of the doctors on tonight are doctors of chiropractic. I may have physical therapists or medical doctors. If you're a medical doctor or a physical therapist, this applies to your understanding as well. Most of you who have been treating spinal ligament or spinal injuries are already doing some things that are beneficial. Understanding the diagnosis and the pattern, the actual lesion and the severity and the location just improves your focus, and then it improves your further education on what to do specific to that so that you can get great treatment results. Now tonight I'm not going to spend a lot of time on great treatment results. Here's what I'm going to tell you, right? This is one of the most successful treatment modalities for spinal ligament injuries. However, to me, when a doctor has something like this, which is severe ligament damage to the C2, C3 motion unit and severe craniocervical damage, it may have an effect, and it should have an effect on what you're doing with that patient. Now, I'm going to tell you that, and I'm one of the few that will tell you, and I'm not going to explain it tonight. The purpose of tonight was not to explain how a spinal adjustment stabilizes a spinal instability. But once you understand ligaments, it's the easiest thing in the world to understand. Now, there's other things that you can do for this. There's other things. There's realigning the spine. There's exercises to strengthen the spine. There's microcirculation to actually improve the spine. There's reducing down chronic inflammatory metabolic syndromes in the patient. There's weight loss. There's all kinds of things that you can do for this patient, right? but understanding that this is one of the most important to the treatment results of a patient is, for most of you, you're already there. Now, so what are the three things? Accurate diagnosis, excellent treatment results, and then the third thing is documentation allows the patient access to any benefits they're entitled to. That is huge in an injury practice. Now, why is that huge in an injury practice? Well, it's huge in an injury practice because the patient is totally 100% reliant on you and your documentation to have access to their benefits. A benefit could be getting your bill paid. A benefit could be getting them whatever they're entitled to long term. So a lot of times in injury, there's a medical legal interface, either in personal injury or in workers' compensation injuries. And that medical legal interface is the medical legal interface that determines benefits for the patient. They're totally 1,000% reliant on your documentation. And today, a lot of providers don't understand the simplest things that are needed every time with injury documentation. Now, what does good injury documentation do? Well, it helps attorneys to resolve cases quicker. It helps adjusters to resolve cases quicker. Helps the insurance industry, helps the attorneys, helps the patient, helps case managers, helps everybody involved. Now, what I just showed you simply tonight was diagnosis, and I think you understand the diagnosis, and just by you being able to do that, your documentation is already going to be better. But then when you understand key factors that have to be in your documentation on a regular basis, and this is not rocket science, this is not, a lot of times in my experience, experts are experts in sort of in thought. They're experts in education, but they're not experts in application. Right? A true expert applies things, is expert because he's been in the trenches applying things and knows that these things are true. So there are very simple things that can be put into your documentation, not magic tricks, not magic bullets, not the magic diagnosis that gets you an extra 36 visits because somebody clicks into a computer. Anytime you're sold any of that, it's false, it's true, it's misleading. Now, what is true is that your documentation is what drives all patient benefits. So you got to diagnose everything that's there accurately and objectively so that nobody has any misunderstanding of what's there. You know, if the dog bite specialist doesn't ever take a picture of the dog bite, well, then somebody can actually contest that there was ever a dog bite in the first place, right? So when you get into benefits, you have to have the diagnosis, it has to be objective, and you have to document that. Now, those are the three pillars. Now, what I want your permission right now. I want to show you a very simple program that I developed to make sure that you understand how to deliver all three of those things in your market. And all I want you to do is tell me right now, hey, it's okay to show you this program. It's totally okay. So just, yes, please do. Yes, yes, yes. Good. The treatment, diagnosis is easy. Treatment, on the other hand, not so easy. I'm going to tell you right now, diagnosis is not easy. And rarely do I see, so anybody that's having problems with treatment, I know right away they're having problems with diagnosis, right? Because if you have the proper diagnosis and you understand what the condition is, you should be able to apply a treatment that helps it. And it's only when you don't have the proper diagnosis or you're missing something. So, I guess what I'd say on that is that if you have where treatment, on the other hand, is not easy, I'd love to spend some time with you and go, okay, what are you doing treatment-wise? How are you approaching this thing? Okay, so yes, 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 definitely would be great. Okay, good. So here's what I'm going to do. I'm going to show you what I put together. Right? It's really simple. It's called the Soft Tissue Injury Specialist course. And it's an online course, right? What does it do? Well, one, it has a whole module series of videos that tell you just how large the market is. Just how large the market is. The market is astronomically large. Any doctor that says, oh, I got a hard time getting new patients. I don't know how to get new patients. I'm like, you can't walk. If you're in a busy area, you can't walk a mile. I mean, 1 in 4 households, I want you to just think about this tomorrow or when you're driving. 1 in 4 households you drive by has a migraine headache patient in it. That household has 70% increase in medical bills just for that one person. Increase of 70% with a migraine headache sufferer. 50% are not diagnosed. The other 50% are diagnosed with migraine headaches, which isn't a diagnosis. They're undiagnosed doctors. Those people are withdrawing. They're withdrawn from their groups, from society, from work, because you know what? When they actually get the prodroma of a migraine headache and they feel like they want to puke, and they're sitting in a lunchroom at work, and they don't want to be embarrassed, they're withdrawn. They'll do anything to actually get a diagnosis to get rid of this thing. 1 in 4 households you drive by and tell me you got a new patient problem. What I think, when I teach this program, if you can't start to actually implement these things, I think you got a heart problem. You don't have the heart. You're not compassionate enough to understand just what you can do for these people, right? On the second module, it goes over how to diagnose this condition. Once you diagnose it, how to do very, very simple treatment management things to actually improve your results with it, right? Then I also talk about, a lot of times if we're talking injury work, you're in a medical legal situation. So how do you handle pre-existing conditions and things like impairment rating, and what do the insurance carriers need in order to get good documentation? That's all in a course. Logical course, you can go through it at your own speed, at your own time, right? So I also have a bonus section, and in the bonus section, I say, great, you want to go out to attorneys, you want to go out to medical doctors, you want to go out to people and start actually saying what makes you unique and how diagnosing this condition does make you unique, and you want a simple program to go out and take to them, it's there. Now, how about, do you want to, let me go back one. I also have in the bonus section getting more internal referrals. So that's how I'm going to teach your staff, or you're going to teach your staff exactly what makes your clinic unique, so that when they're talking to patients, they actually can tell the patient what makes your clinic unique. I mean, I can walk into, I watch doctors sometimes sit there with patients that go, you know, on and on. You tell them that you're a doctor of chiropractic, or you're a medical doctor, you're a pain management specialist, and they start telling you about the pain in the neck, the pain in their back, the headaches that they have, all kinds of things, right? You listen and listen and listen. I just say, okay, look, here's the thing. You have a ligament condition that's causing that. The ligament is the tissue that holds the bones together, and nobody's ever diagnosed it for you. I bet you, I'd be willing to ask, and I just ask them, has anybody ever diagnosed, took a look and said, hey, do you have a ligament condition in here? Is anybody, any doctor you've ever worked with? The answer is always the same. No. Good. That's what you have. So here, I'm going to give you a card. I want you to come into my office for a complimentary consultation, and I'll explain to you exactly what the problem is. Right? Would you like to do that? Good. Here's my card. Don't talk anymore. Why are you spending any more time talking? It's just that fast. Okay, you're an expert, you're on vacation, you're doing things leisurely, whatever. You can help people, but that doesn't mean you have to go on and on and on about explaining what it is you're going to do to help them, because the help is where? It's in your clinic. That's what we're going to teach your staff, right? Now, once you understand how to deliver the product clinically, right? Once you understand how to do this clinically, then you got a message, then you got to market. That's why we created a whole marketing package. And what does the marketing package includes? Well, the first thing it includes is what's called a point of sale display. That's the thing that you put up in your clinic that has a QR code in it, right? It has pamphlets that explain what does an injury, why are spinal ligament injuries so important, and how are they tested for. Spinal Kinetics puts out a good pamphlet. If you want to create your own, you can create your own, but you put out a point of sale system. Well, and all that means is that it's just in a plastic device that holds the pamphlets right next to it, right? And it starts to talk about these ligament injuries. Now, what does it have on it? It has a QR code on it. And when it has a QR code on it, what can the person do? Well, the patient can actually go, hey, they can scan the QR code and get a downloadable copy of this book. Now, what does this book tell them? This book tells them what makes you unique as a provider. It tells them what makes you unique as far as being able to deliver this product. It tells you what makes you unique, doctors. Now, you also get a photo picture viewer slider, it's called. Now, what is that? Well, a lot of you have clinics where if a person walked into your building, they wouldn't even know that you focused on injuries to the spine. They wouldn't focus that they wouldn't know that you focused on injuries. So we put up what's called a video slider. That's a 30-minute program now that just has slides that explain different things about the spine that patients can watch. It doesn't have any music, or it does have music. I'm not sure if the new one has music or not. I don't recall if we put music on it, so it's not totally irritating. Your staff don't have to listen to the same music over and over and over again. But now, up in your counter, you have a point of sale. You have a QR code. They can download a free report. They're seeing things in your clinic on injury, and you're starting to focus them in that you are an injury clinic. Now, what about marketing resources? Well, your social media are a great place to post things. So we have created literally hundreds of posts of things that say, about these conditions that you can post to your social media accounts. Now, some of you don't even have a social media account. Guess what we did? We went and said, hey, we'll customize a Facebook timeline cover for you, or a YouTube channel art for you, or a Twitter background for you for your clinic, so that as you develop a Facebook fan page, or as you develop a YouTube channel, or as you develop a Twitter account, and you start using this free social media, we'll create a customized piece of cover art, right, for you, right? We also have condition-based videos on all of these conditions that you can plug into. You can send to attorneys if you want to. You can put on your website if you want to. You can put on your YouTube channel if you want to. They're just simple videos that express the same thing in video format of what makes you unique. Now, here's the other thing that makes my program super unique. Every month, we have new marketing pieces for the next month, right? So every month we create for you brand new marketing pieces. Now, the marketing pieces can include a flyer that you personalize. You fill in and you print these out. You fill it in. It's a PDF fillable flyer. You fill out your clinical information, and you fill this out, and you can hand this out to patients. You can use it in seminars, webinars, your patient education classes. You can use it in your referral groups. You can use it to send to medical doctors. You can use it anywhere you want to, right? We take that month's pieces and we create some specific marketing pieces for your social media, and we create some videos. And each month is something different, something totally different. Every month. We do it for you. It's all done for you, right? So probably the big question of what you're asking. So I want to ask you right now, of what you saw right then and there, have you seen any other thing in the market today that has that many marketing pieces for your ability to go out and market what it is that makes you unique that you deliver? Have you seen anything like that before? Go ahead and just put in, no, I haven't. How much does it cost? Good, we're going to get to that. This looks amazing. How much does it cost? Okay, we're going to get to that. We're going to get to that. And now I've never seen anything like this. Okay, good. No. Okay, good. So the big question is, what does it all cost? Right? Well, it's really simple. $49.97 is what we could have charged for it. That's easily in the future. Probably this is what we may charge for that. Now, the reason is real simple, right? There's a market for it. And that market, as I'm quickly realizing, and we have been quickly realizing, is pain management centers will easily pay for that. Because that pain management person that comes in and they understand how to diagnose this condition, 3 shots is anywhere from $8,000 to $12,000. So that patient, either that chronic pain patient or that injury patient, is worth, you know, in an hour's worth of work, 2 hours worth of work tops, is worth a great deal of money to these providers. Now, that's not what I'm going to charge you. That's not the price. I'm not even going to charge you $29.97. I could easily charge $19.97. At the first of the year, I will increase. There'll be a $9.97 initiation fee, and then there'll be a $97 a month program fee. That's what the when I take this out next month, and we're retooling some things right now. This is sort of a pre-launch. We're going to actually take it out, and it'll cost $9.97 to get in at first initially. Then it'll increase to $19.97 with a $97 fee. Right now, what does it cost? It costs $97 a month. I know a lot of you are going to say, okay, you know, you're kidding. I'm not kidding. Right now, it costs $97 a month. How do you get it if you want it? It's really easy. You go to smartinjuryeducation.com. So you take a piece of paper and a pen and put smartinjuryeducation.com. What does it look like? Smartinjuryeducation.com, you just go out to it. It's a website. And when you pull the website up, it's going to ask you for your name and email, right? It's going to have a front door to the website. And that website, it's pulling up slow right now because of we're on this GoToMeeting. You just put in your name, Jeff, put in an email address, your email address. Good. Get free instant access right away. Once you go in, it's going to give you a video about the program clinically. You can watch it if you want to. If you don't want to watch it, you basically just go to the next one. Click when finished, see a short video explaining the marketing program. If you don't want to watch it, you just click here to subscribe. And that's literally how easy it is to get involved with this program. Right now, currently, for about the next, I don't know, today's the 20th, for about the next 11 days. That's how easy it is to get involved with that program. Now, here's what I'm going to tell you. If you have questions on the program, you call me at 800-940-6513. It's $97 a month, doctor, and there is no long-term contract. Okay, it's $97 a month. If you go in and you don't find value, then we tell you to stop. But remember, each month we're delivering a very unique, a lot of you struggle with marketing. You struggle with coming up with ideas. Well, what am I going to do? And you know, you don't have a marketing schedule. You don't have a laid out plan on what you're going to do marketing. We handle that for you each and every month. Now, here's a question I have for you. What if all this did was help you to put one new injury patient month into your clinic? What if that's all it did? Okay, that should be about $60,000 in services. For some of you, it's going to be twice that. Okay, for others of you, it's going to be maybe you're at 25, maybe it's 30,000. Okay, but I'm going to tell you based on today's numbers, this is pretty close to what the charges are for one patient, right? So over a 10-year period, that's going to be $600,000, right? What if it put 3 new injury patients a month into your clinic, all right? It's an additional $180,000 a year. Now, what I'm going to tell you is in the program, we strive for $1 million worth of services a year on injury work. And to me, that's not a super high goal, especially today as you can start to develop a multidisciplinary practice. But for a sole provider, those are good numbers. So what if all it did was helped you establish 2 very good medical referrals this year? Okay, we're talking $97 a month. What if it improved your understanding of every patient that walked through your door? What would that be worth to you? What would the confidence increase be with the patient when they pick up your confidence in your understanding of what they're doing with just on compliance with your treatment plan? You know, how much would that make you? You know, one of the things that I understood very early on is that cash flow and money replenish themselves. You know, when you're in business, you have this cash flow and the money, it always comes in, it always replenishes itself. And hopefully, you know, not as much of it goes out as comes in for you. right? But you always have money, and you always have to make choices on what you're going to do with the money, right? The thing that doesn't replenish itself, though, is your time. And so if you can speed up your learning curve, your time is extremely valuable. And that's what this program is designed to do. It's designed to speed up your learning curve. Now, what I said to you is at the end of the program, what I said is, hey, if you stayed to the end and you wanted to copy this, you just hit me with an email, drkronk@americansick.com, and I'll give you a copy of this ebook. So that's what I had to show you tonight. I'm gonna end by actually going now into some question and answers. If anybody has any questions, you just basically type it right into the box. This is okay. Here I have a comment. This is a great value. This is a doctor who already signed up with the program. This is a great value that you should do. Every chiropractor needs to do this to increase their clinical competency. The public needs us, and we need to standardize our delivery of care. Thank you very much for your time tonight. I so appreciate that. So appreciate that. So the program is really, really simple, doctors. It's just you go out to smartinjuryeducation.com. And now is the time to do it. If you're sitting back and you're thinking, oh, I've seen programs like this before, and, I'm just not sure. I'm going to tell you right now, if you cannot afford to risk on yourself $97, your problem is not money. It's not money at all. Matter of fact, if $97 seems like a lot of money to you, I'm going to tell you money is not your issue. It's not even close to your issue. And what you'll get inside of this program will help to correct the issue that is there, right? Because if your ability and your understanding of what you deliver and the importance of it is super solid, okay, you will have plenty of money. Because I'll tell you what, when it's almost, when you're that confident on what you're doing, it's like attracted to you. You're like a magnet. And so, what I guess I would finish with saying is, if $97 is expensive to you, there's more issues there. There really is. And I'm not saying that to try to belittle you or anything else. I'm saying it because once you get in and you're on the other side and you're understanding and you're seeing just how large this market is, and you're starting to talk to people, you're going through this educational process, and all of a sudden you're starting to talk to people, and everybody you talk to is like, you're going, that's a ligament injury, that's a ligament injury, that's a ligament injury, that's a ligament injury, that's a ligament condition, that's a ligament condition, that's from spinal instability. I know how to diagnose that. I know how to do the certainty. It really becomes fun. It's rejuvenating. It rehabs your purpose, because your purpose, no matter what you're doing, is to help people. And when you understand ligament injuries, I don't care what kind of practice you have. I don't care if you have a wellness practice. I don't care if you have a weight loss practice. I don't care if you have a neuropathy practice, if you have a chronic pain practice. I don't care what kind of practice you have. When you look at diagnosis, it's looking at the symptoms and working backwards, and those symptoms actually produce those physical phenomena. And that's just the way it is. So when you're starting to be able to deliver on that, at that level, you've seriously elevated your position in your community. You seriously elevated a lot of things, and you can feel really comfortable going anywhere. I don't care if it's going into your local hospital, going into your local neurosurgeon, going into some of the providers that are the most difficult to talk to. So I would tell you, don't procrastinate. Get involved. I'm going to finish with that. I would love to see you in this program. Again, it's at www.smartinjuryeducation.com. Go to it, get involved, and I'd love to see you in the program tomorrow. Doctors, I thank you very, very much for your time. I hope that I've shared some information that is helpful for you, that it will help you to be able to better supply your area, your patients with an understanding of what they have, and it will be useful for you. So thank you very much for your time. I appreciate it, and you have a very good night. Good night.